Interesting thing and good thing about tirzepatide is compared to semaglutide is dual hormone action. So it has GLP-1 and GIP receptor agonist actions. So tirzepatide activates both GLP-1 and GIP receptors. The added GIP effect enhances appetite suppression and weight loss effectiveness. So yeah, it is good. And GIP activity actually offsets some of the GLP-1 related gastrointestinal side effects like nausea, vomiting, those kind of things. So tirzepatide is actually the better drug. Again, it used to be just too expensive to recommend, easily, but now the pricing became much better. So remember, tirzepatide doesn't directly burn your fat or reduce your weight or size. It just gives you good, appetite suppression. So rest of it, you have to work on it. So on this video series, we're gonna cover everything. Please continue to watch and listen to my videos and the YouTube videos and stuff so that you can learn what to do to become healthier. It's not about scale number reduction. It's really about your healthy life and you live longer without cancer, functionally, healthily. It isn't all about that. So we're gonna cover a lot of things, but again, we are starting with the medication 101. Then we're gonna cover a lot of things and continue to watch. Contraindications. So that means, people who should not take GLP-1 medication. So the first one is medullary thyroid cancer. And second one, multiple neoplastic syndrome type 2, which is very rare kind of endocrine cancer. And type 1 diabetes, if you're pregnant or if you are breastfeeding, you should not take it. I mean, there is no safety data over there. That's why we say you should not. And if you drink alcohol on a regular basis, pretty good amount of alcohol, probably I won't recommend taking GLP-1. Instead, I will recommend stop drinking alcohol. So medullary thyroid cancer, because people kind of often have thyroid cancer, family history of thyroid cancer, but medullary thyroid cancer is the rarest cancer type in human. There are four different types of thyroid cancer in human. Usually, medullary thyroid cancer is more common in rodents and other animals, but for human, it's not so rare. So if you're worried about thyroid cancer, let's say, for example, your grandma had thyroid cancer, then ask her what kind of type of thyroid cancer you had. Usually, before the cancer diagnosis, they do have the cancer type exam and everything. So just make sure. But usually, I haven't seen. I think I have seen one medullary thyroid cancer family history, and even that case, we can just frequently check the thyroid function panel and kind of work with their oncology doctor or their PCP. Alcohol consumption and dehydration can significantly increase the risk of pancreatitis and cholecystitis while on tirzepatide. You really need to quit drinking alcohol and you have to maintain proper hydration. So alcohol, I know some people, I mean, even my patients, they still kind of drink some alcohol, probably drinking one glass of wine just once a month or 2 months, with food might be okay, might not cause any trouble, but still you're increasing the risk of pancreatitis. So I say, yeah, you should just please stop drinking alcohol on this medication. You're just risking yourself to some kind of very bad, nasty disease. Pancreatitis is not something you want to have. All right, so patient's due diligence. Okay, what you need to do on this therapy and with me is you need to follow the 75% rule. Again, if you overeat, you're going to have a lot of trouble. I have seen people, even though their appetite is kind of well controlled and suppressed, they don't feel hungry, they still eat a lot because of emotional reasons. I mean, that happens. I know, we all know. But it is not good idea. There was probably the one of the few cases my patients like puked and threw up a lot because they overate on this medication. So yeah, so let's try not to do that. Usually with good effectiveness of medication, people don't feel like eating that much anyway. The second one is maintain active communication with me. Stay in close contact with me, which is Ian, our team, if you experience any weight loss plateau, side effects, or running low on medication, or whatever issues, requests, and questions, just reach out to us all the time. We are here to help guide you through your journey. um, we use secure chat for communication. So we typically communicate through the secure chat on our patient portal. So if you want to use an other method, like the phone call or email, just let us know. But I found the text message and secure chat the easiest and most convenient way for communication. You have to stay hydrated. It's really important. Hydration is key to prevent constipation, fatigue, and other dehydration related side effects, and especially pancreatitis and cholecystitis. So the best way to hydrate yourself is not drinking whole lot just once and just not drink for several hours. It is sip 6 to 8 ounces of water kind of every hour. So continuously, constantly hydrate yourself so that your body can use the water. It's good. It supports your metabolism, energy, and digestion. And digestive discomfort, heartburn, and kind of frequent burping, those kind of things can occur because of the reduced stomach acid. To support digestion, I highly recommend apple cider vinegar. Apple cider vinegar is really good for your digestion, really good for your whatever SIBO or um, the leaky gut syndrome and other digestive problems, but it is another great way to blunt your insulin spikes and glucose metabolism episode of vinegar. And it prevents kidney stones too. Once your diet changes into plant-based diet, I kind of usually recommend, which means I'm not saying you have to go vegan. I'm saying you have to eat a lot of good fresh seasonal vegetables. Your oxalate level can go up, and if you have if you're prone to get this kidney stones, you're actually increasing the risk of kidney stones. The best way to prevent it, apple cider vinegar. So it's good. Lemon water is really good too. But if the symptoms get too severe, actually taking betaine HCl supplements is a great way too. Tirzepatide can lower your sodium. It's another very interesting thing. So for some reason, you feel really tired for some reason. I don't know what it is. I have a headache and I'm so tired. Suspect your sodium level could be low because of tirzepatide. In that case, kind of try to eat salty food. You can actually add good sea salt, Himalayan pink salt or other black salt, whatever good salt into your drink, or eat low carb salty snacks like beef jerky, no sugar, pickles, or the sauerkraut, or high sodium kind of supplements, electrolytes like Element, which is very expensive sodium. But now try them first and see if your symptoms get better. If they get better, then probably they're from the low sodium. If you still feel very tired, then I don't know, we have to figure it out, because tiredness and fatigue are very kind of multifactorial symptoms. I think that is pretty much it for the medication instruction, medication 101. So again, if you have any questions, you can reach out to us anytime on Simple Practice, our patient portal. Usually, I don't respond to secure other text message or phone call out of my office time, but I sometimes answer at night or early in the morning because I really care about my patients. Thank you for watching. In the next video, we'll talk about supplements 101, what they are, why they matter, and how to choose the right ones for you. Thank you so much, and see you next time.